Let me make sure I turn on the mic so everybody can hear me. I'm going to call the meeting to order. It's our joint Board of Managers meeting, along with the Finance, Planning, and Investment Committee meeting also as well. I invite Ms. McDonald for the prayer, please.
Good afternoon, everyone. Let us pray. Gracious God, thank you for the gift of this day and the chance to serve our JPS community together. You know the hopes and plans we carry in our hearts. Help us to trust you to direct our steps. Fill us with energy, wisdom, and humility so that the way we lead reflects kindness, fairness, and love. Give us courage in our decisions and joy in working side by side. Bless this meeting with creativity, focus, and a spirit of unity. Amen. And now let us stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I don't believe we have any citizen
We did not.
address. And before we begin, good afternoon, everyone. Since we just met last week, there isn't a lot of new report today, but we do have important business in front of us, reviewing, discussing, and approving the budget for fiscal year 2026. This budget is more than just numbers on the page. It's what keeps our hospital strong and able to provide care with dignity for everyone in Tarrant County. I want to start by saying thank you first to Trent Petty, who chair our Finance, Planning, and Investment Committee. Trent, your leadership, your guidance through this budget process has been steady and very much appreciated. I also want to thank Dr. Duncan, our CEO, and Ms. Kim Hodkinson, our new CFO. I don't think she knows what she's getting herself into, but thank you. Along with all the staff who put in so much time and effort to prepare for the budget materials for us. And most of all, thank you to the entire JPS team, our doctors, nurses, and frontline caregivers, as well as the administrative staff who support them for keeping things running smoothly every single day. As we look at this budget, we also have to keep the long-term view in mind. The voters of Tarrant County gave us a huge responsibility when 82% approved the bond that makes possible for our $2.5 billion master facility plan. That's an incredible show of trust in JPS. And now it's up to us to make sure we plan carefully, stay on budget, and deliver on what we promise. We've already got a great example of that. On September 10th, we'll be holding a ribbon cutting for the new PEC. And I'm proud to say that it's on time and on budget. Thank you. That's exactly the kind of outcome our community expects. And it shows that what can happen when everybody works together with focus and discipline. So today's meeting may be straightforward, but it's important. We're making sure next year's budget is solid, that our big facility plans stay on track, and that JPS continue to serve this community with excellence. Thank you again for your leadership, your service. With that, let's get the meeting underway. We need a motion for approval of our minutes. Any question? If nothing, all in favor, signify by saying aye. Aye. Any opposed? Motion passed. The next item, report, no board approval. I'm going to turn over to our CFO for the update.
All right. Hi, everybody. I almost forgot that we had to do July today, so we're so focused on next year. So, anyways, in your packet you had the financial statements. I would like just to call out a few highlights on the income statement. We actually performed very well again for the month. We had a nice performance. We had just under 15 million net income for the month. Some of the drivers for that is our volumes are up. Our volumes are up everywhere. If you looked at the graphs in the deck, all the volumes are up. We're up surgery, ED, inpatient, everywhere. We're over 94% occupancy. We're killing it everywhere. Not killing people, killing the budget. Okay, sorry. Yeah, so on the revenue side, we're seeing a little bit of a pickup in the rate, which is the revenue per unit that we're seeing. We are seeing a little decline though in the case mix. The acuity of the inpatients were down a little bit in the month of July. When we move forward though, that was about 6 million that helped us on revenue, and we had another 3 million based on volumes coming in. So between the rate and the volume coming in, or how we get paid per visit or encounter, it was about a $9 million pickup for the month, which is super good. We had about $1.8 million from retail pharmacy, continues to grow and outperform on the budget. If you were looking at the supplemental Medicaid line, you're gonna, oh, that was negative. Well, remember, the DISH money that we didn't get, we had $7 million budgeted a month. And so for the last 3 months of the year, there will be a $7 million negative variance sitting on that line for the last 3 months. The good thing is we got a $2.2 million one-time that came in that helped offset that. So one of those gifts that we get, and that was from the Medicaid supplemental. So that was a prior year settlement. Other things that happened in the month that were helpful, we did supply chains doing an awesome job. Charlie Cobb, the new VP, we're reviewing a striker agreement, and they found $1.4 million in rebates that we are entitled to from 20 to 24. So collected that. So we'll continue to dig into our contracts, continue to renegotiate our contracts, but that was a nice cash gift for us. The other one is the timing. We received about $900,000 of claim incentives, quality incentives from activities that we've been doing with payers, and so we received those in the month too. So a lot of favorable activity along with the volumes that we had really helped offset the DISH negative that we knew we will not get for the last 3 months of the year. So good month, solid performance. When we move forward, operating margin is 5.7% for the month, again strong. Again, that's with the ad valorem in it. When we take it out, it's at a minus 28%. Remembering that the ad valorem is there to help us pay for the residents of Tarrant County that are using our facilities, so that there is care for all. When we move on, this is the statistics page. I could read down the page for you, but almost every single thing is favorable. And you know, at MedExec, they started to laugh at the last meeting about the V word, right? The volumes. You guys were funny to listen to. Don't say it, it's volumes. So volumes continue. I will go forward to the back to the financial goals. I actually color-coded them so that they were easier to figure out where they were this time. So all the greens are at stretch or above. So 8 of the 10 are at stretch or above. Blue is at target. That is operating revenue per adjusted patient day. It's just barely below stretch. So we would expect that by the end of the year to push through that. And then length of stay, which is a challenge for us, and it's not just us, it's most health systems that take care of a very wide population. It's getting them into the nursing homes. It's getting into a safe environment so they can heal. And so Dr. Assad has done some great work with the teams, the hospitalists, in bringing this down, and we just will continue to work on this. So with that, that was my quick financial report. Are there any questions from the group? All right.
At this point, we entertain the motion for approval. Second. All in favor, signify aye. Aye. Opposed? Motion passed. Next item, please.
Awesome. In your packet on page 25 is a page where we're requesting to fund the pension plan for fiscal 25. Each year we do a point-in-time review of what we're funded with the pension plan. And again, remember the pension plan is frozen, so it was frozen, so there are no new participants in it. But we have to look at the current value of the future liability. I know that was a lot, but we do that. If you look at, you go down the page, you'll see planned fiduciary net position at 103.05%. That means that's how much we're funded for the plan. Last year we were about 88. The market and the rate we use is what kind of dictates our funding level. So we're in a good place. We want to make sure that we continue in this good place. So we're asking this year for a contribution of about $17.5 million, $17,518,127. It's a little under last year. We'll continue to evaluate this as we move forward, since we are overfunded, but the market volatility can put us in an underfunded position. And so we are requesting from the board to approve this pension contribution.
David, you have a question?
So the discount rates, how does that look compared to what other public entities have typically been charging? Because I know out in other entities that I've worked with, they're usually up at 7.25, and some are down as low as 5. So what's our rationale on that discount rate?
Our discount rate is measured at a point in time. And so that was measured at, where are we? It was a 12/31 measurement for last year. And so we measure it at a point in time, and we don't have the variability of saying, oh, today we want it to be 7.25. So to answer your question, how it compares with other, this is an ERISA plan, so how it compares with others, it's within a range, but it again, because you measure pension at a point in time, does that answer your question, David?
Yeah, it just, that 6.75% generally drives a lot of that.
It does.
And that's a big conversation in terms of actual liability around the plan, because if you overestimate that, then you end up coming and having to spend more money. So just making sure we're on the more conservative side of that.
We are, and I had some conversations with our administrators around that. We're going to continue to watch that and also look at what would be the right time for measuring, because we can also move our measurement period if we wanted to. We would just have to do a plan amendment, excuse me. But I think right now we're in a good place. I think there's some conversations about the pension we can have moving forward.
Thank you for bringing that up, and just a little bit of enhancement to this discussion on discount rate. The higher the discount rate, the less our contribution. The lower the discount rate, the more our contribution. Is sort of counterintuitive, but David's asking you, is the discount rate appropriate? Doesn't want to be too aggressive, and then we end up writing a big check 5 years from now.
Right. Our plan defines it on 12/31, and then it defines what we use to establish the discount rate. 675 is reasonable this year. I think we just need to continue to monitor it, to your point, and I will keep doing that.
Yes. Yes. Any more questions? If not, entertain. All in favor, signify aye. Any opposed? With one abstain.
I just want to say I voted.
For a raise. Item C.
All right, so we're going to move into contracts. This is an agreement with Solventum, formerly known as 3M, as DT knows. This is approval for $9.5 million for 5 years. This is an extension of an existing contract. This is actually a necessary tool that we have. It does provide computer-assisted coding, but it does more than that. It's called an encoder that actually then translates. And so it's a required piece of software. This is not one of those luxury, we're putting it on top of the software because it's doing AI, computer-assisted coding. It's doing computer-assisted coding to help get the bill out the door. So, so this is a necessary piece of software to run the revenue cycle.
Any question on this? If not, entertain motion for approval. All in favor, signify aye. Aye. Any opposed? Motion passed. Thank you, Kim. afternoon, Joy. How are you?
Hey, good afternoon. Hi. All right, I am bringing forward for your consideration approval of an additional spend with ARUP reference lab testing services in the district. This extension for a one-year term is $4.4 million, and ARUP provides is our primary reference lab, so our send-out testing for some of those very specialized, unique tests. When we executed the initial contract, we do our very best to guesstimate our volumes for what they would be over that 5-year term. And as Kim mentioned, we've been seeing a lot of additional volume year over year, and so this allows us to continue to provide that necessary testing for our patients so that our physicians can make sure and take the great care that they do for our patients.
Any question for Joy? If not,
So is the 4.4 million fixed price or depends on volume?
Yes, that's, now that we're looked at, we have one more year left. What we try to do is what are our trends that we're seeing and project that for this, to get this through this last year of this contract term. So I'll be back again with an additional contract at the contract term end with ARUB.
But like, are we writing a check for 4.4?
Oh, no. No, that's our budget, and yes, that's the scope of our budget with the PO for this agreement, so that then we can, they can bill us against that, yeah.
it should be billable too for us to receive. So this is to generate revenue for us also.
Yes.
Any more questions? If not, entertain a motion for approval. Second. All in favor, signify aye. Any opposed? Motion passed.
All right, this next one, I'm seeking your approval of a second addendum to the master agreement for terms and conditions between the district and Care Fusion Solutions. Essentially, this is a $10 million spend over a 5-year term for our Pyxis machines, so our automated dispensing machines that are across the entire network that manage our medications. So this is the rental software service agreement for our Pyxis machines.
Actually, our PE firm took them public way back.
Yes, way back.
Any question on this? Fix it. If not, so move by Trent. All in favor, signify aye. Any opposed? Motion pass.
All right, that's it for me.
That was the easy one for you.
Yes, wait till Brian gets here. It's Brian's turn.
Hi, Will. How are you?
I'm well, sir, and yourself?
I'm doing good.
So I have a request for a $2.4 million ask for SHI Government Solutions. They are resellers of our Microsoft license. We're still, many of you know, we're still on the migration path going from on-prem to the cloud from Microsoft. So what this accounts for is the expansion of license, kind of the bridging, and then the true-up from Microsoft to account for the license. And we're getting into the phase next year where we'll start to right-size the license and true up.
Oh, I see. Are we like 80% there, or?
From a license perspective, we'll be 100% there shortly. The cleanup is still in the file stores.
Okay, got it. Thanks.
Question, is this expenditure for on-premises licensing?
No, this is the cloud license.
This is just the cloud license.
This is the cloud license.
So is this like Microsoft 365?
Exactly, that's what it is. The license going from F3 to E3.
Okay.
Motion.
Thank you.
On in favor, signify aye. Any opposed? Motion passed. Thank you, Will. Hi, Brian. How are you?
Good afternoon.
You have a lot on here.
I have quite a few today. So my first request is a contract with J.E. Dunn. It's the initial GMP for the medical office building, part of the facility master plan. This is first release of actual job site activity for some excavation and soil retention, earthwork. A little bit of elevator equipment for $40,738,127.
question
Sorry.
for Brian?
So this is the first of it, right?
Yes, this is the first on-site activity contract.
We want to get that shovel in the
Favor
ground.
say aye. All in favor? Any opposed? Motion passed. Nobody abstain either?
The next request is with J. Dunn again. This is for the central utility plant. Again, part of the facility master plan. Contract request for $127,000,000, $48,542. This scope of work is for some site demolition, some soils abatement, and a significant chunk of the major equipment for the central utility plant, the boilers, the chillers, generators, elevators, switchgear.
Any question? If not, then, yes.
You know, with these, guaranteed maximum price, these GPA that we're getting, guaranteed maximum GMP, that we're getting, are we, and I've kind of talked to Daphne a little bit, you have a plan of how we're gonna track the spend with the subcontractors with these projects?
Yes, absolutely. So when these contracts come through, the general contractor is required to come back to us, show all the bids they received with their scope analysis and the value associated with each price. So we do get a review on their vendor, their subcontractor selection. General contractors come to us when they have all that compiled.
And then once they're selected, how are we gonna track the spend to make sure that we have small businesses and local businesses involved? And what measures are gonna be in place to track the spend to those subcontractors?
So overall, they issue a schedule of values for their contracts, so we know by contract section, whether it's excavation or steel or electrical, what have you. So we have the breakdown of all their costs, and then within that, they have contractually the goals of percentage of participation by all the vendor types.
So are we gonna bring back the BTG system or not? There's a system that's in place to track those payments, to make sure that those subcontractors, once that prime gets paid, they have, 7 days to pay their subcontractors.
So are we not
Maybe
doing that?
37 days.
Yeah.
To pay
We
that
have software.
subcontractor. So we used to have, used to have the BTG system. So we probably need to make sure we're gonna put that back in play, either through, I'm just asking, who's gonna run that system? Is that gonna be through facilities, procurement? Because we don't have a case strategy like you had on the last part of the bond, or that something Ramon is gonna do? How are we gonna track that?
So as far as payments go, that's a contractual obligation between the general contractor and all those subcontractors. And if they're not getting paid, then we would tend to get a notification through them, but we're not tracking.
We
do still have the system, and
Oh, okay.
we will be working, we now have a different program manager, and that'll be a partnership
Yeah.
between probably Charlie's team on the procurement side, the facilities team, and the program manager. So we will bring back that process, because I know you've asked about that in the past. And we did have a process that was in play when we had the former program manager along with K Strategies. We brought that system up. We needed to do some refinement, so we have work to do there.
Yeah, and I think that's gonna be important, and especially since you're spending all these multi-millions of dollars. I don't think that it should be in the hands of just the general contractor, saying that they're paying a subcontractor, the owner, which is JPS. Us, we need to make sure we're providing that oversight to make sure that's happening, to avoid problems as it have happened in the past.
So, yeah, there's a requirement on our pay apps that lien waivers are submitted as part of the pay application, which document payment to all their subcontractors. So I'm sorry, I didn't understand the question initially, but yeah, we will have line of sight to payment.
We
From
hear
GC to
what you're
subs.
saying, and we will
As long as
ensure that,
you have a system, you
Yeah,
need
we
to
do.
find a competent person to
Yeah.
use it.
Yeah.
And then it's something I can help out with. If
Okay.
you need me to, that we can help out with, because that's very accurate. It's
Yes.
used all over the country.
we've been using it actually here, so,
Yeah.
yeah, to track that, but we will we hear what you're saying, I'm sure.
And it will be reported back to finance, right?
Yes.
Okay, so you're part of finance also as well. Okay. Motion to approve for approval? All in favor, signify aye. Any opposed? Motion pass. Next item. And she will continue to move for approval.
Okay, the next request is with Atmos Energy. This is the relocation of the required natural gas line to will serve the new central utility plant, ultimately the new hospital and the pavilion. $752,035. No,
Is the pipe big enough?
pardon me?
Is the pipe big enough for that?
The pipe will be big enough. That's why, it's a new pipe, so we're making sure it's plenty big.
All in favor, signify aye. Any opposed? Motion pass.
I'm abstaining from that one.
Abstain. Item J, please.
So the next request I have is with Southwest Elevators. It's for $1,102,909. It's for a full modernization of elevators 38 and 39, which are in the pavilion building. And this is part of a overall elevator maintenance strategy.
They're the local firm also as well.
Yes.
Motion to approve. All in favor, signify aye. Motion passed. Item K, please.
Request for extension of a current lease we have with, for 1212 and 1214 Main Street. Facility we currently are leasing. This is another three-year term for this property. Primarily used for training.
Any question?
Our package is 1 year, but I think the one that was on the portal did say 3 years. It's
Yes.
having a 3 year.
3 years for $248,000, yes.
Move to approve.
All in favor, signify aye. Any opposed? Motion passed with 3 years.
Okay, the next request is for a construction contract with Beck to complete the build-out of the Health Center for Women. This is the space in the first level of the parking garage. It's 21,000 square feet. This is a result of an RFP, and anticipated construction start is later this year, pending contract approval.
This is the latest RFP that just came out.
Correct.
So how many contractors submitted us?
We had 4 bidders.
Four?
So is this gonna be the permanent location? We're gonna
Yes.
get rid of the one that's not-
Yes, we're leasing that right now.
You-
That's a good question. I don't remember talking about this before.
So I think there was early version discussions, but this has been the plan for the last 18 months or so.
Is there still space left for another business? We were talking about some sort of a retail or?
There will be, well, this will be the defined retail space in the garage as part of the necessary requirements there. There's also retail space that will be in the lower level of the MOB, which is right next door.
I thought in the garage there was gonna be, in addition to the room facility, something else.
No, sir, just this space.
No retail.
No other retail on the ground floor, no. No other part of the parking garage.
Motion for approval. All in favor, signify aye. Opposed, motion passed. maintenance contract.
So the next 12 contracts are all in the same category. So I have a summary slide here of the contracts that are, we're asking for approval on. These are all our annual maintenance contracts. And these would go into effect, if approved, October 1 for the next fiscal year. And we've broken it down by the specific trade categories. We did issue an RFP for each of these sections. We have a variety of responders. This is based on expected annual spend by category.
Yes, this is what we'd like to do.
Just one.
No one wants to pull it in.
All in
All at once. This will be items M through X on your agenda.
I have a question. In the cases, there's 5 cases here where you have 2 vendors. How is the work split up between the vendors?
That's a great question, and I would say it depends. For example, in concrete work, we may have some people that are more facilitated with renovation of existing or renovating versus a new pour. When it comes to plumbing, it might be somebody who is better at med gas versus sewer. So there's a variety of reasons. All contractors were vetted based on their history, their references, their familiarity with the JPS facilities, et cetera. So there's a full vetting process. And in some cases, it's who's next. So like for an electrician, the electricians primarily would cover almost anything electrical. But there are some additional reasons that might be utilized depending on the trade, if that makes sense.
Fixed pricing or is this unit pricing?
This is unit pricing based on historical. They would be billed out at per scope, per request. Yes.
I'm going to take a vote. All in favor? Oh,
So
sorry.
you said these are, so we're approving estimates, so what if these numbers come in higher? Are these the numbers that was actually put out to RFP, they got approved? Or are they estimates like what he said, and then they come back in and bring, oh, this isn't 1,125, this is 2 million?
So these are not on a specific defined scope of work today. So for example, if we would have, for the HVAC, if we would have an air handler go down, we don't know if it's the motor or if it's coil or what's causing the problem. And so we would bring in one of these vendors' price, and they would be a portion of their contracted amount for that specific work, and we would be able to validate. It can go up and down. Yes, these are based on annual spend.
Well, this is total.
Unit
spend,
pricing.
So we negotiated kind of up front so we could lock in with the vendor. Yeah.
Do these prices include parts or is this just labor?
Both.
This is, okay, so you've got like a part list.
Yes.
Pricing.
So everything is based on historical data from the past?
Correct. Correct.
This all comes out in the capital maintenance budget?
The operating maintenance budget, yes.
Operating, we'd have to come
No.
back if we exceeded it.
Any more questions? All in favor? Signify aye. Any opposed? Any abstain? Nope. Okay. Move on. I think that's all we have for you.
I think that's it for me. Thank you very much.
Madam CFO.
Make sure you're ready.
Floor is yours.
All right. Thank you, everybody, for your support, your questions. I met with 7 of you on the budget, so your questions were great. I really appreciated the time. I'd be remiss not to thank Whitney and Suzanne. They're sitting in the back of the room. They have been leading the finance team, and we were working pretty late even last night, finishing up the budget. So you'll see some changes from the deck that you were sent last week. Nothing great, huge, but we did make some changes. So, so I just wanted to say thank you to the finance team. They've been working really, really hard and very patient with me as the new CFO. So I do appreciate all their time and energy and wanting to acknowledge that. So, Dr. Duncan, did you want to say any comments or Trent before we dive in?
No, I do want to thank all of the JPS team. This process actually starts, a reminder to the board, actually starts back in March, that we start meeting with the different business units, includes really about everyone that has some sort of leadership position here at JPS. And so it goes on for a long time. It's intense. It gets evaluated. As Kim will speak to you about, this really comes down to how much more access we can provide, what that volume, additional volume is that we can provide, that really drives then how we begin to set the budget. So I want to thank you, Kim. I know you and I have been in quite a bit of conversation and just trying to think through what's best. I will end it by saying that this is a budget that we feel allows us to continue doing the work that we need to do, and also to be able to fund our master facility plan. The only caveat I will say is that although we've had some strong financials, investment in the future is huge. And so I just want to caution the board to think more about future needs. What we're doing today is probably not what we will need to do in the next 5 or 10 years. That does take investment. I think all of you know that. And so as we begin to look at how we are going to spend our money moving forward, we really need to think about what that investment in the future begins to look like. So with that, I will leave it to Trent to maybe open up some comments for the board if needed.
Globally, as you all know, this process is not necessarily about aiming at a tax rate. It's about making sure that we're providing the mission for it's always an eye toward diversifying revenue stream, always an eye toward efficiency, and, improved operating efficiency, always an eye toward the employees, always an eye toward making certain that we're fulfilling the mission. At the end of all that becomes a number, and that number is a number that we have to, as a board, endorse, and then that number obviously goes to the commissioner's board, where we hope that the budget becomes the driver on what the tax rate is set, but we also know that there's always a little bit of play in that. But this year, I want to distinguish from previous years, because Kim and her team have really taken this through, in my opinion, a much more empirical process. There is a lot of justification, there's a lot of data behind the numbers that we see, and there's going to be a lot more. Remember, Kim is starting with 5. So this is an evolving document, it's a breathing document. I think staff's done an amazing job. They've had to pivot many times back and forth operationally to walk through this relative to capital expenditures and just the operating changes. The budgets coming from the county health department. A lot of things that are not in our control in this budget, but I think staff's done a great job. Kim, congratulations. It's taking the budget in a different trajectory than it has before, and I think it's a great job. So we look forward to your time.
Thank you. So I will say that the deck that's on your iPad is the one we'll be going over. So if you have your paper that you printed out from last week, there'll be a few changes. So if you want to make sure you're following along, or we'll go with the flow. All right. As Dr. Duncan said, this is forward-looking. We are really setting the foundation as we look forward to this year to refreshing the strategic plan and really starting to move into a 5-year forecast activity. So we're looking at a balanced approach, and balance doesn't mean net zero to the bottom line. It means balancing with our initiatives of engaging our workforce, providing access for the community we're serving, and driving innovation, because we know innovation, we need to go there, and we need to continue to leapfrog. We don't need to follow. We need to really look at where we need to go. So this budget is really setting up that foundation for us to move forward into the next 5 to 10 years as we move forward. Some of these slides you will have seen at the budget retreat. I'm just going to repeat them a little bit. This is the operating margin performance. what you're seeing is the green line is the operating margin with the ad valorem in it. The black line is without the ad valorem in it. And the numbers, if you're a tables person, are at the very bottom. The dotted box you'll see on all the slides as a reminder is that's because it contains two fiscal 25 numbers. One is the budget, one is the projection. It's just keeping you from reading across without stopping and going, oh, two belong to the same year. The solid is the budget, and occasionally you'll see fiscal 27 because it's just a reminder that we're moving forward past 26 as we're starting to think about how we plan. I will make a comment. I know we had some great conversations around the improvement of the black line. We want to continue to see that negative performance improve. I will say that when you're going from the projection this year of minus 27% to minus 33 next year, that's really being driven by the one-times we experience. It would go back down to about 32% minus when we take out the one-time things that hit that do not belong to future performance. So we're on a good trajectory. We do need to continue looking at access and how we perform moving forward. But I just wanted to bring that up because I know that is a line we want to watch and we do want to continue to improve. One of the questions you have is then how does this continue to fund the future fund? I added these gray bars on that shows how we grow the future fund. You can look at the bars or the graph at the bottom. The chart at the bottom shows that we are increasing to about $1,750,000 next year. The 27 number just shows you it would go to $2.2 billion. That includes the $350 million of the second tranche of debt that we would be looking at in 27 for that cash. Again, growing that future fund whose primary focus is the master facility plan right now. And so moving towards that.
Kim, that 2.231 is up against the projected budget now is 2.5.
The budget is actually being reviewed right now. So again, we're still finalizing those numbers. And so when those are ready. All right, so how does the budget get built? We talked about this, volumes, volumes, volumes. That's the foundation. Until we know the services we're providing, we can't figure out the staff, we can't figure out the revenues or any of the other expenses we need. So this isn't a carry forward budget where you spent $2 million last year, so you're gonna spend $2 million next year. It's gonna be based on what we need to provide so that we can provide for the care. Once we establish the volumes, we look at revenue, expenses, and non-operating. Non-operating is basically interest expense, investment income, and the ad valorem. Then we look at any operational changes and initiatives we want to put on top of our where we were running. And then when we have this all put together, we can say, what can we afford to spend in capital, or what do we need to afford in the capital space? So when we take that, we've talked about volumes. It's condensed them down. Don't worry, we won't have as many volume slides as we did at the retreat. These are admissions. This is the admissions on the left side that's showing you acute admissions, NICU, behavioral health, and observation. These are the heads and beds that we have. We have maximized the beds for fiscal 26. We have no more capacity until we go to cohorting. We are looking to get a waiver to actually put more than one patient in a room going forward, but we have maximized the adult beds for next year in this budget that we have. That's 442 adult beds. And next question is, what will the new hospital have? The new hospital will have about just under 500 adult beds. It'll have also women's and NICU. That'll give us some more capacity. We would probably fill that up today, and then we have 72 beds that are shelled in. That could create more capacity. So just kind of giving you that forward look of if we're maxed out now, where are we going? The right-hand side tells you where we have some opportunity to create capacity on the inpatient side. The length of stay, we have a reduction for next year. We can still continue to look at reducing length of stay to free up capacity. The biggest challenge for us is where do these patients go? If they can go to home, that's great, but they have to go to a good home and a home where they can heal. We have the challenges, just like nursing homes have staffing challenges, rehab has staffing challenges. They may not be able to take care of that patient. The patient may not even have a home. And so length of stay actually is an opportunity, but we have to figure out the post-discharge environment to actually help us with that. Surgery, surgery volumes, again, this is inpatient, outpatient, in the ambulatory surgery center at Arlington. These are the volumes we have an increase budgeted for next year, correlating with both the inpatient volume as well as emergency room. We are looking at continuing to grow those volumes, continuing to improve throughput in the ORs. That means making sure we're maximizing the block times that we give to the providers, even the room time turnover by housekeeping, and also looking at how do we extend hours for surgery.
Ken, for both of these slides, was the decrease in volumes that was predicted for this fiscal year due to the HVAC replacements and the ORs? Is that why we predicted less volume this year than last year?
Are you talking about the budget for 25?
The budget for 25 was a big drop.
I would say so. Yeah, we predicted that. We had a different plan from a construction and OR perspective, and so we really have been able to compress the schedule, so the impact is a less amount of time.
So that was, you predicted that'd be a significant impact on our volume, the HVAC work.
Yeah.
Volume looks like it's gonna go up compared to last year.
Right. So Jill, I think it was a much longer, now we've compacted it in to a couple, 3 months.
3 months.
3 months instead of a year.
Right.
So,
Thanks to whoever made that happen.
Dr. Assad did some great work through the OR, yeah.
Construction team, they're doing a lot of pre-work before we actually have to shut down the OR, so they're doing work on the roof and getting everything ready, so we really maximize the time, or minimize the time that the ORs are gonna be down.
I mean, if you had to put a dollar value on what didn't happen, it'd be a big number.
absolutely.
It's great work.
All right, on the right-hand side is emergency and urgent care. We know the emergency room is our front door. We know that this continues to grow. It's growing over 4% a year, continuing to see that growth, and so we expect that to continue moving forward. You'll also see the PEC is that little slice at the top, so with that opening in September, we expect to see a small growth next year, but we also know that there are many patients being seen in the medical EDs now, and so that they just go to the ED. When they have a crisis, where do they go? The ED, that's their top of mind. We'll be looking at opportunities with the police and perhaps walk-in business to really, how do we drive the PEC with the business. But we have to think about when patients are in crisis, what's the first thing they're gonna think about, right? So, all right. Now, this is a very busy stack bar. This is the outpatient stack. You'll see the ED and outpatient surgeries and PEC are all at the top. But this is showing you that we have the primary care and specialty clinics and behavioral health clinics. These are the outpatient. This is where patients are coming for health. And this is where we need to see them out in the community and taking care of them. So lots of volume. We are looking at increasing the capacity there too by looking at templates, schedules, productivity with the providers in order to get more patients in the door. So those are the volumes. Any questions on the volumes? Okay, great. We're going to go to revenue now. No reading ahead. Right. All right. You saw this last time. This graph shows you that our percent of our total revenue from patient revenue, or what we bill, is the dark blue. And we're seeing that go up over time. It's about 46% next year. And from the ad valorem, we've gone from about a third of our revenue to now just over a quarter of our revenue. So again, we're seeing a good mix of patients, a paying mix of patients for the organization. The payer mix, we have not changed this. We do expect to see a decline in the commercial. Remember, the volume's going up, so it doesn't necessarily mean all the commercial is going away. It just means we're seeing more Medicaid, more self-pay coming through the system. The ACA is probably the biggest driver of this, with the additional support that comes through is going to go away on 1/1. So some of our patients are going to drop the ACA. They'll go to self-pay. Some of them actually do qualify for connection, but not many of them. So we will be looking at seeing an increase in self-pay in that population as we move into the new calendar year. All right. Here are the supplementals. I only put one of the two charts on here. Again, it's going down for next year. We are seeing a little bit of decline in HARP and Africa. Africa is reallocating some of the dollars to uncompensated care for next year. So we are seeing a slight decline. Remember, the 265 that we're projecting this year includes 35 million of one-times. So it's 230 down to 213, not 265 to 213. So we'll continue to monitor one-times. Again, I'm asking for your grace this year when one-times come in. They could be good, they could be bad. Kind of like the dish one we got this year. So again, remember, that's a little bit of a wild card for us.
Kim, you're 26, you backed out 35 million one time, that was the true up. That takes the 265 down to 230, so you're expecting a further cut, and that's gonna be from.
It's coming from Africa. So it's interesting, you have to put Africa and uncompensated, the green, together right now, because they moved some funds from Africa into the uncompensated care pool. But the uncompensated care pool was going down. So that's just another math equation. So we're going to see a little bit less, and then we're going to see Atlas. Actually, it's not even on this graph, I don't think. Sorry, I can't read it up on the screen because of my eyes. So yeah, so Africa is going down. So it's just monitoring the funds.
And you've got to cut HARP too.
Yes.
Why did that happen?
It just is based on the pool of funds and what we expect to receive based on our modeling that we can do.
And is a lot of your modeling for these supplementals coming from Michael and Sword?
We talked to Michael about it. We also get numbers from the state that we can use to estimate some of these pools, and we make the best estimates. We look at history. We look at what there's projecting, what the pool availability is projected to be. We make our best guess on what we should include in the budget.
You're leaving DISH pretty much alone.
Yes, we do not expect DISH to go lower than what we got paid this year. This 27 million is a pretty small piece of the pie. And so we're expecting when we do the analysis this September, we would not expect it to go much any lower than that.
Could go higher.
Could go higher. But again, we don't have anything to tell us today that it could go higher with 50% or better certainty. It's kind of my rule of thumb. 50% probability or better, should we put it in the budget? If it's in the low 30s or we're really not sure, we don't put it in the budget. Operating revenues, we looked at pharmacy last time. I just really wanted to reiterate, this is a great additional complementary service line that we do have for the organization. And to the ad valorem. All right, is everybody awake? Because I'm gonna have to really explain this to people. All right? You saw this graph last time. The total ad valorem, and this is without appeals, this is just the ad valorem we get before appeals, anything else. The green number, I'm going to use 22 as the example. The green number of 512, the very first one, is the total. There's a little 1949 number under there. That's the debt. That gets bigger to 29 later. 510 is for maintenance and operations. So when we go to the 25 budget, we have 518 million at a tax rate of 1825. Everybody see that? Okay. That's what we're also projected at for this year. We are proposing, well, our no new revenue rate is 17792. It's up at the top in the red. We have put into the budget a no new dollars rate, which means 518,515. We would get the same dollars next year that we got this year, which puts us at a tax rate of 17417. So slightly below the no new revenue rate of 17792. That's an $11 million change. basically, if you want to know what the difference is for those two numbers. So I'm going to stop for a moment and see what questions there might be about this. This is not what was in the deck. We had talked about no new revenue. We talked about that as an assumption at the retreat. It was in the deck that way last week. We really feel that we can produce and deliver on this budget at a flat dollar amount. So moving forward with the $518 million. Dr. Duncan, did you want to say anything else?
No.
Even at this rate, how much profits are we projecting next year?
2.9% operating margin, we would make $150 million net income.
150 million.
At 1741, you have 150.
Mm-hmm.
What was the profit you were estimating at the no revenue rate?
It was the same. We worked on the budget last night because we really wanted to say, is there something, can we come in lower than no new revenue? And that's what we were working on last night. We found $11 million of initiatives that we could bring forward in order to get at a rate lesser.
It's the same number.
Yes,
You found $11 million to offset that.
correct.
Find what the initiatives are.
The initiatives center around revenue cycle, workforce optimization, and then we found some other opportunities in the
Supply
budget.
chain is a big one.
Supply chain.
Revenue cycle, and workforce.
Mhm.
I guess I'll be naive. So budget makes sense when you're next to a strategic plan, right? So there's a goal and the number of people that we serve and all that. So what are we doing, or what are we leaving on the table? Because it's all, esoteric, right? You're jumping at some of these numbers simply because they're very hard to get to, from a budgeting perspective. Dish and other things are so, like the variations and that are so wild. But I guess the question I have is what are we doing today that is inefficient and ineffective from a large scale that can drive revenue or that we would want to move if we have other investments? Two, what are we leaving on the table with that same amount of money? Because that, to me, those are the answers to the question of whatever the no new revenue rate is what are we leaving on the table, or what could we essentially gain efficiencies in to offset that?
Right, so as we looked at putting the budget together for this year, this next year is really a year of enabling. And so we have a lot of initiatives. 4 is going live in June. That has some startup costs, about $2.5 million of startup costs. So we have a lot of enabling, a lot of campus planning that's going on, so there are some negatives that are hitting the year. With that said, we're looking at workforce optimization, which is, to your point, how do we become more efficient? And we've already kicked that off. That has built into the budget about $25 million of improvement, or 250 FTEs. We will continue that work. That work will not be done through a RIF. That will be done through attrition, upskilling staff for the organization, and using technology to do some of the work. And so as we move forward, that is a large initiative. We have a new supply chain leader. He's just on board, just getting his staff on board, and so he is already kicking off some initiatives. We need to look at pharmacy. We do have a big risk in pharmacy around 340B and the changes coming up. So we have these core initiatives going into place, but we have some enabling activities going on too behind it this fiscal year. So we put in everything we felt we could accomplish based on the risks in the budget, knowing that as we move forward with a strategic plan, we'll continue to outline those things you described. Does that make sense?
What you have projected here is everything that you've shown us that we can do. And it will come in based on the budget that you're presenting, and based on as we
Yes.
We'll be able to do all those things and still make it $150 million.
I still believe that's a maybe, and I understand the concept. I also understand we can have some major hiccups, and so when you talk about the 150, that's the one that I have the hiccups on. We might not, and we might do more, but even though she has it in there, we still need to be showing some additional dollars because we're gonna have some cost increase.
So Kim, do you want to just speak maybe why you have a 2.9% margin?
Sure.
I mean, because that's really what we lay out first, is really kind of what are we going to need for the rating agency, being able to pay back additional debt that comes through. So do you want to speak a little bit about the 2.9%?
Right.
What the $150 million will allow us to do?
Right. So one thing I would like to share is that 150 includes investment earnings of about $92 million. That number can go all over the place. So depending on what happens with the markets. So we're looking at 60 million from operations plus another 90-ish from investment income. So I want to keep that in mind because investment income is a little volatile. We rely right now on that investment income to help fund the future fund. And that has been helping it build up at a faster rate. So to the 2.9% was so we can get to the right future fund balance from operations and investments, because we're going to need investments, and spend our routine capital that we need every year. That's about that $45 to $50 million we need every year going through 2030. We've done some projections, which we'll update with the strategic plan, but the 2.9 is where we need to be solidly. We also need to remember that we need to keep, when we go out for debt in 27, if we make that decision, we'll need to stay within that rating. We would like to stay at a AA. If we go down to an A rating, we will risk about $900,000 a year, roughly, in additional interest expense that we would have. So we need to, at least through 27, we need to be watching that. Once we issue the debt, we have some flexibility, but we are on the low end of a AA organization right now. We are at 180 days of cash. Our operating margin is a little lower. The nice thing that the rating agents do say is that we have a piece of our revenue that is more guaranteed than our payer mix, which is the tax revenue. And that's why we're a AA. And why we don't have to have 275 days of cash on hand is because we do have the county behind us. So as we move forward and we look at 2.9, that's the performance, the minimum performance we need with the investment income to make sure we are funding the master facility plan and the future fund. And it's going to be important as we move forward and to continue to look at operational efficiencies, growing our services, so that we can actually potentially exceed that 2.9 because we're going to have other projects we need to fund moving forward. So.
And originally we had, Kim, what was the total? We had $52 million increase in budget operating income. We also had how much additional cost relative to public health and county number that we got?
We have about $3.8 million, including the mailing of the tax bills.
Got, in addition to what Kim was talking about, which are the initiatives, which include the FTEs, the efficiency measures, all those things, we're still also making up, about $56 million in dollars from net operating revenue decreases and dollars that we have no control of whatsoever at public health. So a lot of that stuff has to be calculated into it, and even with that, Kim's showing 2.9% margin. Hope that happens.
You think it should go up?
I've got a lot of confidence in what the team has done because they, investment income is the one that's the real, that's the big number in what's going to happen. We see 2 or 3 Fed cuts in 26, then we're going to have less money. There's no doubt about it. I don't know what that's going to look like on the days. But that's a very, and cost.
And our patient mix.
Inpatient mixes.
Patient mix is the other one based on what federal and state policy does.
Yeah, because it's likely with the changes in Medicare that we're going to see a pretty substantial increase in connection.
Self-pay probably.
Self-pay probably, but also probably connection up to.
A little bit.
Yeah.
Yeah,
You can't basically that are having a drop off.
yeah, exactly. No, you're right.
Right, we'll also see most to self-pay in another year when the not lawfully presents drop off the Medicaid roll. So they can't go into connection, so they'll be full self-pay. So there's still steps even beyond this budget that we've been looking at and considering as we move forward.
I think it's also important to kind of keep in perspective what this means to the taxpayer. If you know, the JPS tax rate, you know, if you have a $350,000 house, you're paying about $600 a year for JPS. When you look at the delta in the tax rates that Commissioner's Court will have to look at, I mean, literally the difference in that $600,000 house is about $8 for the entire year, about $8 more in property taxes for the entire year. So, you know, what we're talking about relative to JPS is such a small number on the overall tax burden that people have. You look at the school district taxes, the city taxes, we're way, way down the hill. And so, you know, whether it's one number or another, to us makes a massive difference. As a homeowner in Tarrant County, I'm not gonna notice $6 difference in my property tax, because by the time I pay my school taxes, and my other taxes, trust me, got $6 and you leave the department. So I think it's important to keep in perspective. We occupy a small portion of your overall tax in Tarrant County, and I think the team has done a great job of being sensitive to that. But I don't want to be so sensitive to it that we kind of lose sight of the overall impact. Because this is not a gigantic amount of money to a homeowner. I tell people, you know, you pay a lot more for cable television in most cases than you pay for pictures. So those perspectives are important to keep in mind. I want us to be as efficient as we can. I don't want us to lose sight of the fact that the critical nature of our work relative to what people pay for it, pretty good.
You're saying that this proposed rate from no new revenue to 0.17, you get $6 per average household delta, is it?
Yeah, about 5, 6 days.
Okay.
If we had kept it at 0.1825, what would have been our projected?
So we wouldn't have been able to keep it there. The ceiling is no new revenue, which is the 17792, and that would be $11 million more.
I guess, you know, the conversation around JPS Connect in particular, when's the last time we've really looked at the policy governing that, who's eligible to, you know, approved expenditures? Like, when's the last time the board truly looked at, because with the evolving population, there's a lot of opportunities and risk with that group, right? And so, when's the last like substantive conversation the board's had on that particular topic?
It's not been since I've been in this position. Yeah, so it's a good question.
And it's on my list, along with the next slide of investment income. So.
I think the way to look at this, I don't even know if this chart could exist, but the chart that we see in our book on page 63, which is what we're looking at on the screen, layered on the chart on page 53, which is the operating margin over the last few years. And so I think it's the operating over the last few years. So as we have continued to, well, not always, I get my language wrong on this. We don't set a rate, we recommend a rate.
Correct.
But as we have continued to recommend a lower rate, and as the court has done that, our performance has gotten better, even beating our own expectations in that environment of reduced rates. And so look at what we have done, and I say this meeting every year, you're to be commended, as it was. That in a time where we have recommended and the board has adopted lower rates, our performance continues to improve. You know, we say it all the time, past performance is no indicator of future performance, but the numbers that we see, even with these reduced rates, as a credit to the team here, the performance has really done incredibly well, landing at nearly 7% operating margin last year. So, I mean, I think we have to evaluate those two charts together when we have this discussion.
Yeah, Tim, I agree with you completely. The thing that makes it difficult is to use that chart as the precedent for planning. And so much of it in the encompassing care side is just, so unknown. Right. I mean, it's a tough one, and I agree with you. I mean, I think we got to be super conservative, and laying those two charts against each other is fine. But a lot of that falls outside our span of control, and I think staff naturally is sensitive to the fact that if we go out there and say, oh, well, based on the precedents of the past, we should be able to, do this for 20% less. And then we end up with a gigantic Medicaid cut we didn't expect, and another, hit to what's going to happen to us in terms of our case mix. It gets scary, so I understand it.
Yeah, I mean, we said that last year too. Some of us, we're always in this environment, and I think that's the blessing and the curse of public health in a lot of ways. We do have the benefit of the backing of the county, for sure. But I think what you said is in a lot of ways, it's a truism that we say this meeting every year. And so when we have to layer those two things together as we try to make this recommendation, I think that's the hardest data that we can rely on.
How much money is given to the county? Like you mentioned that. What's that?
We have 23 million that we pay for public health and MHMR budget and the tax bill. And we also, though, provide jail services. And the cost of the jail services, including the MHMR that I talked about, is in the mid 80 million mark.
So when was again, apologies for being naive, but when was the last time that we had a substantive conversation with the county on those topics?
They don't have. They don't have. I mean, the bottom line is they don't have. And I've been around here as long as anybody. And the bottom line is our contribution, public health, jail, et al., is based on what amounts to a sticky note. Here's how much money JPS needs to budget. And it's always been a difficulty for us because we have to be accountable for every single dollar when it comes down to setting the ultimate cost and tax rate for JPS. Except that portion of it, we have absolutely no input, no control, no accountability, no nothing as to how much that money is. And that's always been a source because here we are being accountable for every penny, worried about, a half cent. And that number gets handed to us and we just put it in. Now, I'm not saying nobody's watching the store, but I'm saying they certainly don't watch it the same way we watch it when it comes down to what we have to do with our own budget. And a lot of us have advocated for a long time. If you want to put public health and or these services in JPS's budget and give JPS the same authority to have some control over the accountability, maybe we can save some money and do some things that might be a little bit more innovative than what's happening today. But that's an argument that typically falls on that.
We will probably continue to fall on their business really actually. And I know I've said every time that until they come to the table and talk, until we say no to that transfer, there will be no conversation. What is the fear consequence if we just say no? Well, the same fear that you have every year, they're going to set your tax rate.
Yeah, don't have the ability to.
Well, hopefully I wasn't alluding to saying no or taking that as the first step in negotiations, because that seems, again, being naive, I don't understand the politics around it. But there are really three pieces to a public health infrastructure in a county. You have a county public health department, you have an academic safety hospital, and then you have research. And those are your true three authorities that you can draw money traditionally from the federal government, sometimes through the state through pass-through. And the other one that kind of sits out there are the FQHCs. And so one of the things, the extreme deficiencies that I've seen here in Tarrant County compared to similar type entities across the board is those four entities typically don't talk to each other. And so, again, in the piece of the ability for this budget to make an impact, because again, we can talk about the people through the door, we can talk about all this, with that deficiencies of that lack of relationship, you're going to always have one hand tied behind your back. And so in this effort, beyond this, I think next year, again, I'm saying naive things because I've not been here before, but next year, I think we have to have a substantive conversation with the other three portions of that infrastructure, which is academic research, which is the FQHC, and the county, so we can all understand our lanes for what we approach for and what we go for in grants. Because again, if you were to look at, and I'd love to know this actual number, but if you were to look at per capita investment from the federal government into Tarrant County versus a Dallas or a Houston or others, I would bet we are probably sitting 50, 60% less than those other entities have because their infrastructure is more closely aligned. And so as we move forward, again, I understand the no new revenue and all, but one of the ways to solve that is to create better relationships with those other three pieces, because research you can get overhead on, FQHCs you can lay a programming on, and the county is generally the main authority for a lot of grants that come down from the federal government, if not the state. So I know that's a little bit, on my high horse, but that to me is the biggest deficiency in this budget, is that we don't have a true health enterprise, public health enterprise here in Tarrant County.
It's fair. It's fair.
Mm-hmm. Anything else on this page? I will say that our $150 million and our strong performance that we're having allows us to fund the future fund. Most private organizations, if they had a $2 billion project, would have financed more with debt. We have made the decision to finance more from operations, which requires us to produce more from performance on a year-to-year basis. So I think it's really important to remember that when you start thinking about should we compare ourselves to Parkland or Harris. Harris has a $2.5 billion debt issuance for their master facility plan. So we are doing it in a different way. It's not the wrong way, it's just a different way to fund it from most of it from operations versus through the issuance of debt. So that's the other thing that's driving the need to perform in the manner that we're performing.
I don't have a problem with this at all. In fact, I think that y'all can easily make up the $11 million. I have full faith. So I agree with this. I think that the part of this budget that just gives me a little pause is a couple exceptions that we're going to be able to kind of squeeze the last remnants out of our volume, seeing it we're at above max capacity, and we have to continue to perform above max capacity even when we don't have the resources necessarily to do it. And then also kind of the ambitious plan to reduce length of stay, which we have done better on, but even this year we kind of, the projected is coming up a little bit. It's just, I guess it would be nice just to know that we have some other backup options other than those, just to help us kind of meet our budget goals next year.
Those are not the largest pieces of the goal. If you, when we get to the waterfall, growth is about $8 million, where workforce is 25. So those are not the largest pieces. I think, though, we owe it to our patients to really look at some of the community services, and we talked about one of the strategic initiatives at the retreat, to really, one of them would help get patients out sooner, and it is something that is very fragmented in the market. And so as we look at whether it's home care or DME or respite care, of how do we get patients to a place where they have the minimal things that they need, but just sending them home, they don't have them. So to your point, there's some things that we need to really look at that might be easier than trying to get the nursing home to take them because they don't have the staff.
We can agree on most of the budget today, but we're gonna have to come back again like we did last year. Once the court sets the tax rate, we're gonna need to revise that portion of the budget so it's baked in. That's what we're using this year, is the revised budget from last year. So just keep in mind, we can throw whatever tax rate you want out there, but we don't decide that. So we're gonna have to come back, whatever we do today, and revise the property tax portion of this budget to match what the court says.
Unless the court gives us this rate.
Unless the court.
Which that won't happen. It will be something different. Could be a penny, but it will be something different. So you're gonna have to do an adjustment to get our final 2026 budget.
Right, and our ask at the end will be approving the budget as presented, and if the court makes a change in the rate, we would bring it back to the board for a second approval at the end of September. The rate will be set on September 16th.
We understand that, Blake.
Yes.
We'll need I don't think it's scheduled yet. We'll need a board meeting.
We will do another joint, the day of the finance committee at the end of September.
We just had to start somewhere.
Yeah.
That's right.
That's why it
Last
says,
year, we had a little bit of a discussion, should we adjust the budget after we knew the final tax rate? We don't have a choice. We have to adjust the budget to what the rate said.
right, and we're working on what that might mean for the organization and some of the hard things we might have to do. So hence the reason we put 26 assumption on here underneath that. So, because that's just what we had to assume to go into the budget.
Or we can send them a rate that we think they'll take and just,
Unfortunately, their process for determining the rate is a little more arbitrary than our process for determining the rate. And we can say all day long, here's why the budget says what it says, and here's the rationale behind the budget. That means nothing to an arbitrary reduction in tax rate. So I don't know what empirical argument we can make that we haven't made. I know you've made those arguments. The commissioners, as you've spoken, and all of us have spoken, I'm sure, to the commissioners, the judge. I think we all should work as hard as we can, not to set the rate, but to educate us what this budget entails and why this budget says what it says. Because part of this budget is also, as you all know, we have saved a lot of money in the future fund so that we can have the cash that will build these towers, right? If we see a substantial increase in capital cost, which we did, with the CUP, went up again. Now we're talking about the overall master facility plan hovering around $2.5 billion. Kim had to build her first year of her 5-year budget with the idea that, okay, I've got to cover that gap too. So we've got a new capital gap that we didn't have this time last year. And unfortunately, as long as those towers are not built, the cost keeps going up. And so part of this is being able to layer into the operating income enough of this that we're going to be able to make that transfer to the future fund so that we can keep that project moving forward in cash basis. And to Kim's earlier point, it would definitely be easier on all of us if our M&O portion of our rate and our debt service portion of our rate weren't so vastly different. You know, cities and everybody else, there's always a debt piece that you're covering, and JPS just doesn't do that. It doesn't make it bad, it just makes it sensitive, because a slight change, you know, in the capital cost comes right out of cash, and it pushes us into a circumstance where Kim just said, you know, it'd be nice if this were issued in debt, so that we wouldn't have these big, huge fluctuations. And I think that's a policy issue or discussion going forward, for sure, because we do have an inordinately large gap between the O and M portion of the rate and the INS portion of the rate. And I think policy-wise, that deserves a discussion. But we gotta get these towers built. We gotta build them out of cash.
Yeah.
That's all we got.
Trent, I'm not following you. You want our interest to be higher so that we have less for operations?
No, no, from a budgeting standpoint, you budget debt service in a pretty flat fashion, and there's not a lot of default or change in the debt service portion of your tax rate from year to year. Whatever debt you issue, that's what you issue. The remainder is the M and O, right? The remainder, because the debt's gonna be budgeted. The remainder of it's the M and O. So when that portion of the M and O is small, then obviously you've got to be a lot more accountable when it comes to the M and O determination. In our world, we count in cash, and that's just not what the government normally does. Normally, the government relies on some portion of debt and moving that debt forward, and that's even more demonstrated today than it was 10 years ago, because when the no new net revenue calculation came along, the M and O is the portion of the rate that gets all the attention, right? The debt piece of it's gonna be paid no matter what. But the M and O piece of it is the one that's so sensitive when it comes to looking at the no new net revenue rate. So cities are having to either put off or avoid debt as our public entity, because that's gonna push down the M and O piece of it gets reduced, and so now we're even more sensitive to the no new net revenue calculation. So I'm saying from a planning standpoint, if we had a little bit more predictability in terms of the debt service portion of it, I'm all for using cash. But let's face it, we've all gotten beat up pretty good for having so much cash laying around. We got cash laying around because that's the only way we could get these things built, was using cash. Because we would have had to increase the property taxes if we didn't have the cash to do it. There was no other way to do it. And nobody wanted to do that. The promise when we wrote the $800 million promise for the bond issue was, we're not gonna raise taxes to do this project. We knew we didn't have enough money in the bonds to pay for all of it. But my gosh, it's gone up a lot more since then. So it's, our reliance on cash is a little bit under, is what I'm saying. And moving forward, I would love to see a little bit more balance in the INS and then no portion of it.
Yeah, I think our reliance on cash is a wonderful thing, because we're not borrowing money and paying interest.
But you get beat up every time.
Yeah, we do. We do.
I mean, it's one of those things where they say, okay, well, you guys are hoarding cash. No, we're not hoarding cash. We're not hoarding cash at all. Trying to make sure we get enough money to pay for the business.
Well, and your leadership's a reason, big reason why we have so much cash. You've really promoted well, so. The good news is, when the buildings are built, we're gonna pay the last bill, we'll owe no money. We'll have everything paid off. Well, we're paying down our, amortizing the debt we've issued. But we're sort of a model of the way government should work. Less debt, pay as you go, and not borrow every 5 years a big bond.
I agree, and I'm not a proponent. I mean, in my entire career, I've raised taxes one time. I'm very conservative when it comes to that. When you look at fiscal planning, you look at where JPS is headed, this will not be the last capital dollar that we spend.
No, it won't.
When we get a piece, we're already talking about potentially having to finish out space that's not in this budget, because in order to meet the demands on the system, our capacity is not gonna be enough.
Right.
Well, we haven't talked about what that looks like when it comes to the impact on the M and O portion of the rate. I would much rather look at that from a perspective that says, let's at least look at the alternative of being able to put a portion of that in a debt package. If we need to go with others, let's go with others. So far, they've said, hey, JPS, do what you gotta do, because you're important to Tarrant County.
But we've got to take this asset, $2.5 billion now, and make sure we're optimizing the revenue coming off.
Sure.
This can't be just an expense, this needs to be an investment.
Yeah, no doubt.
We've got to turn it into revenue that's going to finance the future capital expansion. We're going to always need. There's a county growing.
very good, easy to understand for a non-accounting person, has made sense. And you could see the movement of the dollar, so I thank you for that.
Thank you, appreciate that.
The one thing that I might reference too is that, and maybe you do it through the finance committee or whatever, again, naive over here, but the forecasting, it would be nice if the board could understand what a cut actually meant in rates too. Like, where would that come from? Like, what are the list of things that, so that way when we do go to the board, you know, we can have that conversation. And so again, not for this year's cycle, but, you know, a -5, -10% forecast would be, to talk about where that money would actually come from, and would be better on the forefront as opposed to if they come back and say, hey, you know, 0.17, you know, because again, without that knowledge, we don't really know as a board what we would have to do.
And that'll be part of the 5-year plan we put together, because we'll put sensitivities on that and say, if volumes go like this, if funding goes like this, what does it mean for the organization? So, good point.
I mean, to that point though, we can look at what happened last year. I know there was we recommended a rate, the court came in lower, and there was a lot of angst and a lot of, there was a lot of hand-wringing and concern about that, and Rory sat right where you're sitting. And we said, where are you gonna take it from? He said, I'll take it out of profit, and we ended up putting more away, even than we projected with that reduction. And so, I mean, I think it's a great point of where do we take it from, but I think we've seen what we do when that happens. We have a case study from Poland.
Not a single expense item changed. We just reduced the projected net income by $12 million, $14 million.
Every goal was met, every patient was cared for.
Right.
It's still saving money.
But you've got to double the number of beds this hospital system has. So to think that the operating cost can be looked at as a static component from year to year. Not anymore. You're gonna have to have a number.
And a lot of that was the distribution that we talked about.
Yeah, they were one time, and,
Right, and
yeah.
and I
And we can't guarantee we're gonna have that level of success.
exactly. And this year's success, 60 million we had taken out from Dish, right? Big negative. We had $46 million of one times. We had $50+ million because the volumes exceeded budget.
Kim, do you want to skip ahead of that slide?
Yeah. So a couple of you asked this question when we were meeting this past week, so I thought it would be helpful to reconcile for you the budget for this year to where the projection is. This is our, these are just the big items. 66.
75.
What was it on the iPad? Sorry, 66 on mine, sorry. So 138 million, and this is net income. So this is bottom line. We had one-time impacts of 46 million. We had a sale of property. We had some other rebates, some things that hit. But the big one, of course, was the supplemental Medicaid and the Dish, the pickups from prior years that we received. The operational impact, so that's almost 50 million right there. 54 million, we had volume increases, and they're all over the board, $45 million, the volume increases alone that we saw this year. Fortunately, we had them to offset that Dish $60 million impact that we had. We did get some other increased payments in current year supplemental of about $14 million. The retail pharmacy's gross margin was up 9. We had some other revenue coming in just under $3 million. On the staffing side, we had a pension pickup of about $16 million netted against some unfavorable benefits. And then we also had improvement in efficiency in staffing, including reduction in contract labor and reduce of some shift premiums. We also have non-labor expenses. Those are kind of all over the board. There's lots of initiatives. Our out-of-network for connection patients is less than we had planned for them. Not that we're withholding care, we're just not having as many going out. For those of you who don't know, for connection patients, if we don't offer the service and it's a required care, we contract for it to go to another facility. So that's what the out-of-network reference means. We've had some timing on initiatives. We have some revenue cycle initiatives that did not happen this year. There's some leases where we had it go down, telecom went down, so there's a bunch of efficiencies in that 21 million in timing that we have not incurred this year. So those two things together, those two areas, operational impacts and one-time impacts, are why we're at 238 million. We have some small non-operating. You might say, why is ad valorem negative? We get appeals, so it reduces our ad valorem. There's some other things that go in there too, but that's big. Investment performance was a little higher, but $100 million change, it was volume and one-times, if you want to just settle down there. So that's how we get to that performance. Could we have budgeted the volumes? Certainly, but my question back to you as a board is, what happens if we didn't hit those stretch volumes? And that's always a question. Can we, if we knew some one-times that 25% chance they might occur, should we put them in the budget? Probably not, because then we're just going to be explaining to you why we didn't get that money. So, so this was just an added slide. It was not in the deck last week. It just came up as a question a couple times this week. So I thought I'd just share it with you so you know why we're starting at 238 million. So I'll stop there. See if anybody's. Pardon? Yes, it is. Well, what we're using, because it sits on the balance sheet until we use it.
And this is not going to put a strain on the volume with our capacity, is it?
What? The budget?
Mm-hmm.
The budget puts us at basically kind of on our trend that we're at right now.
For inpatient.
For inpatient.
Yeah.
Any more questions? No?
So the big skips that I just did, investment income and debt. Investment income, we're flying about 3.8% this year. Investment policy is on my radar to review this year. We are just finishing the RFP on our investment advisor. So we will be moving forward with looking at that. Again, for those of you who are not sure, we do have constraints. We can't do what a normal private hospital could do or foundation. We do have constraints on our investments, but we're going to look at that. And then our debt expense, which you're aware of. Operating expenses, again, people, we're a people business. This is the biggest part of our business. And then supplies are the second biggest piece of our business that we have. Put this back in here just as a reminder that every dollar we get, 56 cents goes to the people that we have taking care of the people. So, and at the bottom of this says 5 cents of every dollar we get is reinvestment, the future fund and capital. So the core influences on our operations are listed here for the expense areas. On staffing, we have the annual wage increase that we discussed at 2.5. We have the minimum wage increase we had discussed at the retreat. Some market alignment on wages. We put a small pool together because we need to have some monies to do that. We had some benefit design changes in our benefits for our employees, and the workforce optimization is the work around realigning our workforce, whether it's upskilling, using technology, moving forward. We do have an FTE reduction in the budget for that, where we expect to do that through attrition. The other areas of expenses, supplies and pharmaceuticals, we have initiatives planned. Inflation for that area is about $12 million, so we have initiatives. It's not just to save $12 million, it's to make sure that our expense per total operating revenue stays at a pretty consistent percentage. So for every dollar we get, we don't start spending a penny more because we've saved 12, but 10 million snuck in over here. So we'll be looking at that. Those are just some of the examples of where we will work through there. Purchase services, same way, and then we have the other activity. Most of that other activity does have an expense associated with it in next year versus a benefit, because the benefit will come later. Here are the human resources. The JPS resources are in dark blue. The contract labor are in the little skinny dark. We've done a great job of bringing down contract labor for the organization, and you'll see there is a reduction in FTEs moving into fiscal 26. Our supplies and pharmaceuticals going up about 19% of total operating revenue. We have some areas in pharmacy that are a challenge for us on the cost side. We also know that we have challenges, we may have some challenges with the 340B pilot going into next year. Other expenses, you'll see the bottom is the green. This is the county. That is the largest in the other area, and then it goes up into utilities where we have some inflation going on, resource management, and so on. So these are the spaces we're increasing. Some of these are one-time initiatives that are sitting here. That's where in for example, our enterprise resource planning system for HR, finance, and supply chain is sitting. So we have $2.5 million sitting in there for that implementation. We have $4 million for the JPOC's renovation, and that renovation is moving people around to create more clinic space. It's not just moving people around. So there's some campus enabling activities in there. These are the changes and initiatives that we put in place. This list is the same from the retreat that we had. Again, we've talked about many of these, but we are looking at AI next year for ambient technology, some other AI enhancements, also cybersecurity, and we're moving Epic to the cloud. And that's pretty important because moving to the cloud enables us a lot to do a lot more things around AI and easier. Here are the capital projects. This did not change since the retreat. These are the actual budget we've spent, and then the project budget for next year is about $46 million, or roughly 100% of depreciation and amortization. Balance sheet. Now this is a little busy. We do the budget balance sheet when we close the year, so this is our best estimate. We just have to, because the balance sheet is a point in time. This is the balance sheet that we used. You can see the long-term debt is on there under non-current liabilities. That's the next year's debt. The future fund, which is the board restricted for master facility plan. Do you guys see that under non-current assets? It's the third line, and then the line under that is the bond proceeds. That number will start to deteriorate. So we'll be reporting on how we're growing the fund, but this will show you when we're spending out of the fund. So we'll be doing separate reporting to show you how much we had and how much we've spent as we move forward. Days cash on hand, we talked a little bit about this earlier. We'll be at 453. We expect next year, again, keeping the 180 days in hand, and the rest will go towards the restricted for the master facility plan. It's a new ratio on here called total debt to operating EBITDA, or simple cash flow. So earnings before interest, taxes, depreciation, amortization. These are the two metrics that the rating agencies look at the most. They want to look at how much debt do you have to the simple cash that you're generating as an organization. When we go out for our second tranche of debt, we'll go up. You'll be happy to know that our debt that we currently have, once we issue our debt, we're good. Our rating doesn't matter anymore because, well, it matters. I shouldn't say that. But we aren't going to get a different interest rate because our rating changed. We're not going to get a different interest payment. We're not going to get it called. Excuse me. The important thing, though, is we're going out for a second round of debt. In order to keep the interest rate down, we want to keep our rating up. Once we issue a second round of debt, we'll want to look at our financial performance, see what it needs to be to sustain. We do need to be a positive organization. It's attractive to people to come work for the organization. But we'll want to look at, will we consider lowering our days of cash on hand? It's a question. It's a question that many of you have asked me since I've been here. So right now, we are tracking as a AA. That's where we plan to stay. We'll be looking at debt issuance unless the board changes their mind, because it's my recommendation. You guys get to decide. But when you see what this does to this debt to simple cash flow, it will go up when we do the second tranche. We'll have more discussions on this. It's more technical than what I just went through.
Yeah, I have a question about total debt to EBITDA. First, the green line, that's Moody's target.
Moody's AA right now.
Like 2.1, 2.2, is that a percent or multiple? What is the
It's a ratio. So it's a times ratio, an X.
So that means debt could be up to 2 point whatever that number
2 times your operating cash.
And then our operating EBITDA includes property taxes.
Yes, it does. Yes, they included that because it's a revenue source.
Sorry, I know you've mentioned the 340B several times, but is the anticipated cash flow within anticipated to change these numbers?
So, since we don't quite know all the rules yet, and for the board members who don't know what we're talking about, there's a pilot for 340B that's currently in a comment period that's supposed to be effective January 1st. It's for 10 drugs, but 10 drugs for us is 55 drugs, basically, because drugs get a national drug code depending on how they're packaged, if they're tablet or capsule or liquid. So you could have one drug that has 15 drug codes, just to give you an idea. We happen to have, for these 10 drugs, 55 drug codes. It can be up to 300 for these 10 drug codes, just to give you, it's a lot, it's not just 10. So, so what it is it's basically the way the rules are written right now. We pay 340B pricing, a very low price point for these drugs. The point of the program is to help subsidize the organizations who are taking care of a disproportionate share of uncompensated or low compensated patients. And that's what the goal is to help these organizations. We are currently paying on an annual basis for these drugs about $2.5 million. What they want us then is to pay wholesaler acquisition cost, which is far above what we would ever pay, and then we would submit for a rebate. The wholesale acquisition cost for those 55 drug codes is $47 million, which means $44 million we'll need to get back in rebate on an annual basis. That will affect our investment returns if they don't pay us within the 10 days. And it's 10 days whenever we submit the rebate information, which we don't know how that will occur yet.
Who's they?
Who's they is the manufacturers. We pay the bill, the manufacturers pay us the rebate.
In 10 days.
Yes, and each manufacturer, because there's more than one, will probably have a different mechanism to submit the rebates through.
And they can appeal it. They could end up not paying it.
They can argue with us.
Yeah,
They can say
argue.
this drug isn't qualified, or this isn't, or you did this wrong, and it starts the 10 days over again. You know, so there's a lot of risk here, because this is a pilot where we're not voluntary. We are required to participate.
When does it start?
January 1st.
So that will have 2 to 3 million for receivables.
Potentially, yeah. Well, it will on the, not the patient receivables, but in the other receivables, yes. It's gonna add actually $44 million to our receivables.
Well, for that year, you want to have.
Yeah. Yeah, so it's gonna create an administrative burden around taking care of our patients.
Is that factored into this budget?
This is not factored in because we don't have the final rules yet. The comment period isn't over yet. That'll be over September 8th, got extended from the 30th to the 8th. There's a lot of things going on. There's some organizations filing injunctions. They don't feel the pilot is legal under 340B, how they were sanctioned. We are working with the state association and Tchd on just the modeling to make sure they understand the burden. This is gonna impact, fortunately we have cash, but if we didn't have cash like the rural hospitals, they're gonna be hurting.
Who's driving this?
The federal government.
HHS?
HRSA. Is it HRSA?
Well, it comes out of HRSA, but I think this was an initiative around getting drug costs down.
Okay.
So it's part of the bigger
Part of the
picture.
bigger, okay,
David, you
policy
might know more,
change,
but it's
yeah.
really about, it's the bigger picture of drug costs.
Yeah, this was through an executive order.
The executive order,
That was
that's right.
driven to specifically talk about HRSA doing this. From a forecasting perspective, I would also expect it not to stay at 10.
You'd expect what?
Oh, no,
Not to, yeah, if
Oh,
this
yeah.
is shown to have any modicum of what they're hoping, that number will go very quickly.
Yeah.
So, I would expect you'll see the data elements on this by end of year 1, roughly, because
Yep.
you can get that pretty quickly. So by year 2 and forecasting 27, you could see this be its own cash flow issue.
Yeah,
right,
itself.
yeah.
right.
David?
And they've already put list 2 out there, and then they're saying Medicare Part D is now the new list, and so it's a big list, and it's not that we can't get the pricing, it's a cash flow and a resource issue to get the right pricing.
Like you said, just administering it and following it internally is going to be a nightmare.
Maybe the purpose of this is to reduce drug usage.
Cost.
No, it's cost.
To the patient. They don't particularly care about the hospital side of the equation. They want, and so if you track through, and I don't need to, you can cut me off whenever you want, but if you track through a lot of their drug pricing approaches, they're driving towards direct-to-patient conversations. And so their end goal, in my assumption, is that you're going to see a lot more patient direct-to-manufacturer conversations. So this is part of that process, and there's a lot of reasons why, but this is part of that process because it adds another layer of billing into the process that allows patients to do some things. So long story short, this will, if it's shown to have any modicum of success on the patient cost of drug side, you're going to see this grow pretty substantially in 27 would be my guess.
But eliminating the upfront discount for hospitals somehow impacts what the patient pays for the drug.
Yeah, because it goes into the conversation with PBMs. It goes into, there's this whole drug pricing modicum on the side that, why do we allow a third-party vendor to essentially set the price of drugs, beyond that? So this isn't, you can see this as one piece to a very large conversation around drug pricing. And it will have hiccups. And again, I'm not a drug pricing expert, but if you tailor it out to where you think it, like the forecast will be, is this in conjunction with more direct-to-consumer pricing around drugs, you're going to have cost savings. At least that's what the economics would tell you.
The only issue is,
The impact to us should be zero.
It's a cash flow problem.
It's a cash flow
Cash flow
problem.
problem.
Administrative burden of the patient.
Yeah.
and we don't expect it to be a zero-sum game with these guys. So I think the other thing is from the acute side is not a direct-to-consumer, so that's another problem. Getting 340B on the acute side is not a direct-to-consumer option when you're in the hospital. So most of what he's talking is they're centering around the retail and the specialty pharmacies, and so it's,
Focusing on the wrong.
well, it's all 340B is all encumbered with all of those, and so they're not splitting it apart and saying we're going to leave the hospital inpatient alone and only look at the retail. It's just everything.
David, do you think they have enough experts in there to look at that whole thing so that it won't create too much of a cash impact? Right, because you
Well,
got,
that's the goal of the comment period. And so the comment period in rule, essentially what happens in rulemaking is you submit a rule, industry gets to have comments, and then they make edits based on that conversation. Sometimes they take, sometimes they don't. And so, just from my perspective, the person running HRSA right now is brilliant. So I would think that they would have a really good understanding of how this will impact their programs.
It's just who's going to influence, the decision. I think Big
Yeah.
Pharma is out there and probably have more dollars than many of us do, so.
And the guy running HRSA now was with the Pharmacy Society of Wisconsin, so he knows pharmacy.
Yeah, he does, yeah.
Tom Engels knows pharmacy. He reminded me of and I worked with him in
but
Wisconsin.
it's hard to predict, right? Volume shifting,
It's gonna be a consumer shift. Right now, in my, yes.
tiering, right? You got formula tiering in that also as well, and then you got market share, you got generic, you got specialty versus traditional drug, you got rebate lag, all that stuff. Somebody have to be on our team to be able to push it back, say you're wrong here, right? Otherwise you have no way of peeling.
That's the administrative nightmare part of it.
Nightmare. So,
Which is, again, if you go back to the governance on what's called the President's Management Agenda, the goal of the rules needs to, there's an administrative component, so I'm hoping whoever's commenting from the Hospital Association puts that as a significant point, because that is an area that they would be willing to talk about, because within the president's management agenda, you have a essential requirement that it's really not an administrative burden to the consumer or the agencies that get it. So again, we'll see how the final rule ends up, but that's where I would go after it.
Okay. That's okay. I think it's important. It's a lot of money. It's a lot of money. This is the waterfall that walks you forward from the projection into the budget. And the buckets didn't really change very much since we went through it at the retreat. But it starts with the 238 that we just reconciled. Takes out, the second one takes out the 46 million at one time. So we're starting with a baseline of about $191 million. After the baseline, that big red bar is inflation. It's almost $50 million. We are one of the few industries in the world that cannot raise their prices to cover inflation. You just can't do it. So we have a $50 million bogey just to start with annual wage increases for cost of living, pharmaceuticals, supplies, utilities, some other services that we have inflation on. So it's a big, just a starting point. After that, we have payer mix impacts where we're getting a little bit of a pickup in Medicare dish UC, okay, Medicare. That goes through the patient payment. That doesn't go through special like Medicaid. Medicaid is different. So in the patient payment, we have a pickup on Medicare, but we have that negative payer mix we talked about. And together, those create that $9 million negative impact. We also have people. We're looking at increasing the minimum wage, as well as a small component to the market, if we have positions that move too much in the market where we need to attend to them. We have the campus planning. This is the opening of the new garage, the demo of the old garage or the Murphy garage, and then the movement around in the office building. We have another almost $12 million related to depreciation going up, almost $4 million for the county, and we have investment income going a little bit lower than what we're at this year. So those are the reds. The greens, and I'm going to go through the first two relatively quickly. Growth is about $8 million. We don't have a lot of growth in the budget because we are pushing the limit, and then we have the growth in pharmacy in there. So about 2/3 hospital growth, about 1/3 is related to the pharmacy growth. We have revenue cycle initiatives. We are able to do a price increase in revenue cycle, but to give you an idea, a 5% increase is a 0.3% increase. So you don't get much. We get a little bit from the commercial payers, and that's about it. So it's about $11 million for a price increase, and we have revenue cycle initiatives about $7 million in the budget. The big one is the initiatives tab. And we talked about the $25 million for the workforce. We have also about $12 million for supplies and pharmacy. So we have about $38 million of positive initiatives going on in the organization. But then we have AI technology implementations that between Infor, AI, and some other technology, we have about almost $6 million of impact to the organization for next year. We have some capital projects we're putting online that have operating expense that are associated with them, and so that will be another $5 million for those capital projects. Those are planned when we approve the projects. And then we have a few, not a lot, but some money put away for strategic initiatives in our budget in case we decide to do one of the initiatives that we talked about at the retreat. All those together take us to the $151 million net income performance that we are showing you for the year, which takes you to the income statement. You guys are probably, I can never lead with the income statement because we get distracted, but it's $150 million, 2.9% operating margin for the year. Back to this graph that I showed you at the beginning. This is what we are proposing for our budget at the tax rate assumption that we put in, keeping the dollars flat at a 2.9% operating margin. So our next steps, we would look for approval today, which we'll get to in a minute, Next, we will provide materials to the court today for presentation of the budget next Wednesday on the 3rd, and then the final tax rate is set on the 16th. If there needs a change to what you are willing to approve for today, we will come back and have a board meeting when Finance Committee is scheduled at the end of September. So we are asking that the board approve the budget as presented, knowing if the tax rate changes, we would have to come back.
I'll move to approve the budget as presented, subject to a change in the property tax revenue, as set by the board.
We have second. Trent? No more question? All in favor, signify aye.
Aye.
Any opposed?
I'm opposed to that, I think we should recommend a lower rate.
We're gonna recommend
I
that?
don't,
Are we
I don't
gonna
think we
recommend it?
recommend a rate.
A lower rate. We recommend a rate. We do that.
We make an assumption, we don't really.
695.
Is that just,
I mean, I think that we have the margin, and I think that, I think it's likely, based on what happened in years past, that I think they will do something lower than what we recommend.
That's right. I think we've been presented a budget by staff that is reasonable. We've lowered it more than the noted revenue tax rate. And I think that's where we are.
Well, I voted no, I mean, so, yeah, I mean,
Yeah, appreciate it.
yeah.
Tim, I think you and I pretty much said the same thing, I just don't know what number they're gonna come up with. I will, a little history, 2 years ago, Karen and Shannon and I went down to Commissioner's Court this month, August of '23, and I spoke to the court, and I recommended a tax rate of 19.8 cents. And I was a speaker there that day. And I went back and sat down, and I'll be darned, Commissioner Brooks threw out a tax rate of 19.45 cents. And I was very embarrassed that he made a better deal than I had offered. So he had, and it was a unanimous vote. So even what I presented to him did a lower deal. And now, look at how much farther it's come down since then. So Tim's right, they're gonna, whatever you present, they'll come out with a lower rate. I don't know, should we recommend a rate at all, or just, that was the spirit of my motion, was let them decide. Should we give them advice as to the tax rate? I don't think we did last year.
I learned a business, you speak first, you lose.
Well, we're speaking, there's a rate piece to this, and, I mean, we're recommending a rate, as we always have, and I think that, at this point, Blake did it well. We see what they do, why not send a rate to them that we think will be acceptable? They're gonna cut it, right? If they do, they do, but I mean, to that point, then we should set it at 18, or set it back to 22,443.
well, that's the problem. And that's the whole arbitrary nature of it. If the goal in the court is to cut whatever budget we bring,
Yeah, I think you ask
I don't
us,
think it is their, I mean,
what is their
do
goal?
you think it is their goal?
I don't know. Because if we reduce the budget with the numbers behind it that show a budgetary standpoint, empirically, what we need, then if that is reduced, then I would expect there to be some empirical responses to how much it would reduce and why. So that we can work toward that. If it's just arbitrary because this number, because the last 2 years, it's been arbitrary. It has been completely arbitrary. Oh, it's that, Tim. Come on.
I mean, I disagree, I don't think it has been.
If the goal was to get a rate, yes, but arbitrary as it relates to what impact it had on JPS. If the idea.
But that's, I would argue that's almost, again, naive here, but the fact that we don't give them projections on what that will actually do is on us. Because we can go talk to them about what rate does what, But if they don't understand the operational impact between rate A and rate B, then we're the ones leaving the information on the table. And so I would argue moving forward, you know, we have 2 or 3 versions of this, of -5 static and a +5, so they can understand what the operational impacts are. Because again, if it is arbitrary, that's because that we provided them a lack of data, in my opinion. And so we solve this problem because, again, we don't set the rates here. We solve this problem by showing them the operational impact between what the rates do, which we can't do with a single budget. Okay.
David, I think that's true. I think that we've always attempted to educate the commissioners before we present the budget. Now, have we done it in a fashion that says, okay, if you do this, this is the impact on JPS versus if you do this? That's a dicey proposition. And empirically, I agree with you. But it's a dicey proposition because elected officials, when they hear budgets from, you know, from appointed officials, always assume that there's a pad, right? They always assume that it's going to be higher than what you really need. It's just a truism. So if we make the argument that says, here's what happens to us if you do this, and they don't agree, they're still going to do this. Because there's always that possibility that they say, well, they're just going to show us the worst possible case that shows the most draconian impact on the organization. So we're going to cut it anyway and make them show us that that really wasn't necessary.
But isn't that, I mean, go directly into the conversation last year where you did have that rate cut and there was no actual modifications of the expenditure side of the budget?
Well, there was the budget was amended, for sure. I mean, we did change the budget to reflect their rate, and we will do that always. We've just been really blessed.
We've been blessed with these one time, David, that we could not have predicted, you know. And then also, as Kim said, I mean, a large part of this is that investment income. We don't know where things are at. I think we are in the most uncertain environment. And so if it's difficult for us today to tell you kind of what our best budget is to come before you, I don't know how we can project what's going to happen year 2, 3, 4, and 5. We would have to hold our assumptions and hold also our predictions of what's going to happen in order to model that. And the last years have shown you that that's been variable. I mean, we've had anywhere from a good 11% margin. This year we're down to 6%. But I think it's just really the uncertainty that we operate, the uncertain environment in which we operate in, that makes it hard for us to predict what future years are going to look like. I think the team has worked really hard. We come out of the gate when that rate gets cut, and we work really hard. We will get to a point in which we've squeezed out enough, and as these new sites come on and we've got to operationalize more of this, it's going to be tighter and harder to do. Again, as I mentioned when we first opened up here, what the board is going to have to help, I think, the management is really in kind of where do we want to be moving forward, and how much of that margin do we want to invest. We know investment in technology, we know other kinds of investments to move where we need to be takes a lot of money. And we have not, as an organization, been an organization that has taken our profits and put it into marketing, into kind of these huge buckets of investment to help us move forward to where we really should be. And so we'll end up staying right here is my concern. The more we cut that, the more we stay here today and not really being prepared for the future. Yeah, I may have a new building, but as far as what we're going to be able to do to generate that revenue, that takes an investment today. And if you cut those dollars, yeah, we can keep existing, but we may not be ready 5 years from now.
Well, my number isn't arbitrary. You go go below 17, still save $100 million, even on this conservative budget. So I'm
Say that
just,
again. You just said below 17, but then you're saying.
let me finish what I'm saying. So you go below that number, still put away $100 million, even on this conservative budget. And I think that's what they're going to look at in the grand scheme of everything, as against, again, comparing these two charts with each other. And I know that you all disagree with me. That's okay. That's fine. Dorothy knows too. But what I'm saying is, when you layer these two charts, that's what they're. I know. That's what they're going to look at. And the margins that they're going to compare, knowing that you can go below 17 and still put away $100 million over taking care of everybody and doing everything else that we budgeted.
But we won't be able to do that for the next 5 years, Tim. That's the problem. We won't be able to do $100 million a year. We're gonna see our investment income, even if the investment income stayed flat, the cash we have is gonna go down as we spend it on construction. And so we're gonna start losing cash as we start spending, or investment income as we start. We need to continue to be strong, because my question to the court will be, is will you raise our tax rate when we need it raised? And that it hasn't been the trend, so.
I think one of the things we,
Because the other benefit that we have in Tarrant County is an expanding base that we've benefited from, and you see that as well. So I mean, I think it's not arbitrary. I think they're looking at all these things, in fact, at all.
Yeah, Tim, I think you're right with the court will end up will be below 17. Just so well, the difference between the 17.41 and what did you say, 16?
16.95.
That is $15 million. So,
In addition to the 11.
well, it's 15 below the 150, or 151. So that makes our net income 135. Now, there's a lot of variables. Kim, I think you've been reasonably balanced in trying to figure out what to include and what not to include, and you just talked about the drug pricing change. Could be a big change.
the drug pricing can drastically affect us. We may be looking at $50, $60 million swing on the
But
drug price.
That'll impact investment earnings is what it'll impact.
The one I'm worried about is this, right? We always say, let's run it like a business. If you're gonna run it like a business, you wanna build up free cash flow and pay down those high interest rates so that you can save on that for operating later on. I don't think we ever talk about free cash flow and all that stuff like a regular business yet. But we just got our CFO here 4 months ago. So those are some of the things that you want to build up the cash as much as you can, because interest may swing. Our interest rate is high when we borrow against our bond. And how do we do that? I mean, if we bring it too small, bring the budget to squeeze it down so much that our credit rating is gonna go. It will kill us another. It will eat up on the interest later on when we pull down the other one too.
Well, again, as I said earlier, that the court's going to do what the court's going to do. That's my motion. Stress over the rate all day. Whatever we say here is not going to affect what the court votes on. It's simply not going to change it. So,
I think what we're trying to set up, and I like the way that we're doing, because like Trent said, we used to set up arbitrary. Now we're trying to put the right dollar amount. It will take time for everybody to see that, hey, we actually paid a lot more attention to a more accurate number. We're not playing the game. And be where it may, we don't have control over what rate they're going to set. But we can always say we set the right budget. We're not padding anything. If anything, we put enough cushion in there so that things may move around, so that we do have that. The last thing we want to do is sacrifice on quality. It takes us almost 10 years to build up to the quality level where we are today. Financially, we made a mistake. Next year we'll come back and make a mistake. Let's increase the rate. That's going to be very helpful during the election year. But
I want to challenge what you just said, because you said that it doesn't matter what this board recommends or does, they're going to set the rate anyway. I hope it matters. I hope that what this board does and what this staff does year to year, day to day matters when it comes to how they look at JPS and how to set that rate. If what you're saying was true, then we've wasted a gigantic amount of time.
Yeah, just give us the rate at the beginning of the year, yeah. Yeah, that's right.
Well, what I've said has been true for the last 2 years, so
Well, and
you may not like that.
That supports my notion that it's arbitrary.
That's how it's gonna work. So they have the same data we have, right? We're gonna have the same information.
They will get this revised today.
Okay, so they have everything but the revisions. And then they've got analysts, all the commissioners are poring over this, and so they're looking at our expenses, they're looking at our revenue, and then there's that last piece, how much tax do we need to provide JPS? And that's why they get paid the big bucks. We can say this rate or that rate, but they have people also poring over this. And yes, they're going to make their decision. And they're gonna do it based on the same data we have. They're not doing it blindly, and I don't agree it was arbitrary last year. Last year was based on the facts, and they were right. And they were right the year before. Commissioner Brooks was right to undercut my recommendation by 0.35 cents. So they're pretty smart.
So the idea is that really it doesn't matter what the board comes up with.
The budget is 99% of the work. For them to come up with the tranche, the tax, that's not that hard. But Kim's doing all the work to give them, and then they're gonna come up with a tax rate. You can recommend a rate. I don't think your recommendation will affect, they're gonna do their own math.
Do they look at public health the same way that you're saying they have all these statisticians looking at our stuff? Are they looking at public health the same way?
I don't know.
Well, I think that's the question we should ask, because you're saying they're doing all this great stuff and they're going calculated, but are they not calculating public health and how their increase affected what we are asking for? I mean, so I think staff does a good job, have done a good job of projecting where they can work from, and I am happy to see that they projected it, we have approved it, and Commissioner's Court is going to do it.
I fear a little bit that we are a victim of our own successes in this, because last year they did decrease the rate. It was a dramatic decrease. It was really shocking to us when we got it, and then we had this banner year. A lot of it had nothing that we had any control about, you know? And so I fear that the court is gonna look at all of what happened last year and kind of, to Trent's point, just not recognize that it had nothing to do with our control. Yes, we continue to serve high volumes of patients, and we do it really well. Patients still want to come to JPS. But the big differences in our Delta were not anything that we had control. In fact, the public going away because of the change in Medicaid. So that's, I feel like, the big message I would like the court, when they are looking at this budget, to take into account.
It's also, look at this way, right? You're talking about those two, if we go dip below 1.16, right? If we're looking at 1.6, was it 1.692 or whatever that you said, versus the other one, that's probably another 75 cents, well around there. Is
We
7.
started at 18.25? Okay, so it's how many pennies?
Based on
You're
his
talking
nu-
about over
based
2
on his
pennies.
number, you're
That's
looking at about
30 million
$7
each penny.
$7 a year. Now we're talking about $7.25, $7.50 a year per household.
I think the argument is, we have, and Kim is working on this, we do need a 5-year budget. Because we need to understand the implications of opening 500 bed jail. And I've been concerned about this for the last, since we did Blue Ribbon, that we didn't look at the true operating expenses associated with that kind of a capital investment. My fear is that if we don't maintain some path, some ability to take care of those towers, we're gonna end up with built towers without people working in them.
Yeah.
And that to me would be an absolute disaster, and I think that speaks to a scientific, careful, planned estimate of what's gonna happen, knowing that even then, there's gonna be a big part of it that's out of our control. We didn't know what was gonna happen this year to the uncompensated care, we didn't know what was gonna happen at 3.3. We didn't know we were gonna be hit with these new cost. We didn't know that our capital plan was gonna be a $2.5 billion capital plan. I'm just trying to approach it from a standpoint of being safe, because my feeling is that we can continue to cut the rate as long as we look at a 12-month window. And it looks awesome. And this is so good. JPS has done such a good job. Let's give this back to the taxpayers. That'd be great, as long as there was a commitment to put it back, if we get to a point that we can't do it. And we can't put the staffing in that red tape. We can't bring in the people we need to run this place. And then all the work that we've done really starts to go away. It starts to erode. We've the Gallup Award for 2 years in a row. We're one of the best public hospital systems in America. And I'd like us to be recognized as that, not just thinking 12 months ahead and we had a great year so we can continue to cut the budget without some understanding of what the future looks like. And Kim and I talked about this. We talked about going ahead and putting 2027 as a column header on some of these so that we can begin to see what that looks like. We got to give our staff time to begin thinking that way, to get to the point that we can have a good, clean understanding of what likely is going to be the next 2 to 3 years. We don't have that right now. And so I'm trying to be cautious and conservative so that we're not in a situation where we have to go back and ask the court for more money and ask taxpayers for more money, because I wouldn't be able to do that. I mean, I don't want to do that. The last thing in the world we should do as a board is get ourselves in a position where we under budgeted so much that we have to go back and ask the taxpayers. And so I have an ultra-conservative stance on this. I don't believe JPS is going to spend it just because we have it. I think we've proven that we don't do that.
We don't do it. That's true.
Because we set it aside, we plan for capital, and we still do very careful operating budgets that reflect a very conservative thought process. JPS is never just going to spend the money because we have it. And so having the dollars available, to me, is a safer position, knowing we're going into very uncertain times, than giving it all back without any idea of what's going to happen next year.
I think we also need to look at cash flow also as well, going to the future, because you're going to have disruption in services. You build on the same piece of land, you're going to have disruption, you're going to have interruption of revenue, interruption of business line. And then we're going to have training, bringing new stuff in to open up new business lines. We open up new hospital for that stuff. We're looking at how we have enough cash for the future fund to build the hospital just to pay for it. But like we all know, when we move to a new house, everything else had to be purchased and put new stuff in there also as well. So. Oh, well.
The court, since I've been on this board, and it may have been different in the past, when you look at this incredible budget that you put together, they don't look at 95% of it. They don't look at the expenditures. They don't micromanage how we're spending the money. The only thing that, since I've been on this board, that they have decided is the tax rate. That's it. And we're not having any discussion either about the expenditures and this, having this budget that can put together and their team. This is a ton of work that you guys have done. A lot of long nights. So they don't micromanage. The court has one decision they're going to make. That's the tax rate. And everybody's making great points, but they will make that decision. If I'm betting, because I've lost to the high side the last 2 years, I bet Tim's really close to where they're going to end up. So we can deal with that, accept that, plan on that, or we cannot, and then we're going to have a surprise here in a couple weeks. I don't care. We're going to end up in the same place. We're going to end up in the exact same place, no matter how much stress we put on it. And you can talk to your commissioners and give them your opinions. I'm not saying that won't make any impact.
Kathy, correct me if I'm wrong, we've already approved the recommendation.
Yes.
Yeah. We're just.
And is there any strategic plan to what Tim is saying of us accepting a lower rate that the court just approves it? I guess my worry, and
Unless y'all are gonna revote.
Yeah, and
vote.
again, we came forward not with a recommended tax rate, we came forward with a recommended budget that was supported by the tax rate, but
We backed into the rate, so it wasn't generated, it was what do we need in order to fund operations, fund our capital, and continue to
that's
fund the
what the
future
board
fund.
asked us to do, is to look at what does it take for you to operate today, to save for the future, and to invest in the future, and this is what we came back to you with.
So you updated, presented to the court. When did the court, they review it? When do they vote on it?
We present to the court on Wednesday next week, and they set the tax rate on the 16th.
So you go in person, physically to
Yeah.
the.
Yes. They have about a 5-page deck.
So you have to-
Yeah, and they won't vote that
And
day.
then on the 16th, I think it is, they will approve the budget and the tax rate.
And did you want to propose a recommended rate or not?
No, I mean, I think the vote has already happened, so I mean, correct me if I'm wrong, but I mean, that was.
The vote has happened.
We voted on the budget that we feel we
we
should
vote?
have. And
This
that's
is the
about it.
budget, we're not recommending
Based
a
on
rate, it
that
has an
number
assumption
that
of
we
rate.
think that we should
Correct.
shoot for. We're not recommending anything, we just be realistic about it.
Yeah.
Tim, I don't think I heard you.
I would say, we approve
You approve the budget.
the budget that we think, the staff think that they need, based on maintaining all the stuff that we trying to do for the hospital. And then,
Not a rate recommendation.
it's not a rate, we just base it on what we think is the rate.
No, because we don't
converted.
set the rate.
And there's a rate, it's a component of this budget that we just recommended.
Well, Tim, the only way we could actually have brought you a budget is to have known the rate, right? Yeah. So we either gonna have to change the process of how this goes. I mean, I think if the rate was given to us as we were starting to build this budget, we wouldn't have this conversation, but we have to start somewhere, and that's with determining what we see to be the needs of the hospital. Now, the court may look at this, as Blake said, and decide that maybe you don't need this or you don't need that, and so therefore your rate's going to be here. And every year we've gone back and we've worked really hard to close the gap on that rate.
I said that we're not recommending, and that there is a rate in here, and it's also consistent with what we've always said in years past. So to say we're not recommending, I don't think is accurate. We are, and they'll do what they said.
Well, the motion was subject to the rate set by the court. That was my motion.
That was your so you approved the budget as presented.
We're gonna have
with
to
that
go back and adjust it. So the rates, yes, there's a rate on here that comes up with some numbers. You gotta plug in that number, I guess you have to leave it a gap, show us the operating loss. But my motion specifically is subject to changing it to match the rates set by the court.
But the expectation of that presented, even though that's probably not right.
Yes. That's not my expectation at all. But that's why I said subject to the rate set by the court. The court will set the rate the court sets. We can put any rate we want on here. That's a placeholder, in my opinion. That's a
Right.
placeholder.
It's an assumption.
It's just
It's
something.
an assumption, and it's labeled an assumption, because to
It's an
Dr. Duncan's
assumption,
point,
yeah.
we don't have anything else to go by. So we've put our budget together to get a 2.9% operating margin, and that's the number that will get us there, the 518.
This is our budget. Somebody's going to ask, what is that going to translate to? We still have to have that number somewhere along the way.
For our AA rated organization, they're in the 5 to 6 range. But yes. It's lower. However, you have to evaluate, are they carrying a large facility plan? And what does their future look like?
It's usually about 1 to 2% if we didn't have these projects.
We're also catching up on some technical debt too that we've had in the IT area. So we are catching up on things too in this organization. So we need those funds to catch up so that we can move forward and be ready.
All right, we're gonna move into, close this one out, so we'll move into a closed session. So we're gonna take a 5 minutes break, but before I do that, thank you so much for your team and the dedication they have for this.
Is he ready?
It's, 3:55, we're gonna resume our regular meeting. I'm gonna turn it over to you for.
Thank you, Mr. Chairman. I would like to request approval to move forward with securing the insurance as discussed in closed session for an amount not to exceed the total amount presented for our premiums in closed session.
All in favor, signify aye. Aye. Any opposed? Motion passed, and that will conclude our meeting for today.
We're adjourned.
Thank you. We're adjourned.